Good morning, Honorable Rosie. Honorable Biscuit. Bistock, sorry. I'm trying to sort out your camera. You are sitting a little bit low on the video. Is it possible for you to move it up away from you a little bit so that we can see your shoulders and have the full head and chin in the picture? Thank you very much. Thank you. Thank you very much, man. Honorable Nkasi, I'm not sure if you can hear me, Honorable from Lesotho. Where's the microphone in that?
I can hear you.
Oh, you can hear me? Yes. Kikopa to say
Yeah.
the way your video is coming out, screening in the center. Nikikopa obey your video in a portrait and sorry in a what's the other way, horizontal. We fetule and we sekamis.
How does it look now?
Kita video ka sa ifrisitse ka mona da teng farela fela nyane. Ha o ka isekamisa fela tlamele be lokile o tsa ro hlae mahetla le sefahlego kaofela.
Bye.
Okay, then is
ICT, can you assist me? My video is frozen this side. I'm not sure if the one of our members' video is properly framed now.
Yes, most of them are in the correct frame.
The honorable member from Lesotho.
Yes.
Is he properly framed, Wilfred? Yes, we can hear you. That you sorry lanyani. I can only one hour na video ya we tla jwang gobane camera video ya ka e freezitse ka mona. Jale ke kopa mosebetsi mo le na ora
Nake from the chest upwards.
Okay, now that should be good. Sorry, I have to log out and log back in again. My video is frozen here. I won't be able to see what's happening. Thank you.
Apologies, honorable members. As I was saying, that my name is Modise Kabedi, the Media Relations Officer for the SADC Parliamentary Forum. The session today is going to be broadcast live on Parliament TV, which is found on DSTV channel 408. Experiencing a little bit of problems with my laptop, so I won't be able to see how honorable members are framed. But I kindly request honorable members to please ensure that in terms of their framing, I see honorable Khase has fixed his framing, which is good. You need to ensure that your face and parts of your shoulders are up here on the picture so that we can be able to properly give your name tag when we post your video on the platform. So you need to leave some space on the sides of your camera this way. There should be some space, and then even here there should be space so that we can use that space. We use the various spaces for the logo of the station that's going to be broadcasting. In this instance, it's going to be Parliament TV, and the logo is going to appear on either side of either this side or the other side. So that's why we need to have a clearer space, and also at the bottom here we need to have you showing the full shoulder so that we can be able to position your name and title there. If you are slouching and appearing at the bottom of the screen, like the face is appearing, we end up having your name on your chin, which is not good picture quality. And I'm sure you don't want to have that kind of image of yourself showing on TV. So please assist us in terms of ensuring that that happens. As I indicated, the session is going to be broadcast live on Parliament TV, which is on DSTV channel 408. We are also live streaming the session on various social media platforms, Twitter, YouTube, and Facebook, those ones of the SADC Parliamentary Forum, and also of the Parliament of South Africa. So that is where we're going to broadcast these. From time to time, honorable members, as you take to the platform, I will also be taking pictures. That is why I need to have at least a proper picture of you so that when I do take the picture, it's a picture that we can use. So please bear that in mind. The session is conducted in 3 SADC PF languages, which is English, Portuguese, and French. There is an option for interpretation at the bottom of your screen. So please follow the prompts there and choose an applicable language to you that you can use. As I said, it's English, French, and Portuguese. You have an option to also mute the original language if you don't want to hear it as well on that option. Thank you very much.
Dennis, good morning.
Morning, how are you?
I'm fine, thanks. You may wish to address the House in terms of when are we starting the meeting?
Yes.
Sure.
Yes, we're starting the meeting shortly. The vice chairperson who is sitting in for the chairperson is trying to join the meeting, and we may.
Yes. Hello, everyone.
Hello.
Good morning.
Good morning, Honorable Vice Chairperson. Welcome.
Apology for a late start. I was trying to feel. Hello. Hello.
Hello, Honorable. We can hear you.
Hello. Yes, I can hear you. I wonder if you can hear me as well.
Yes.
You can.
Yes, we can hear you.
Yes, I was sending my apology for a late start. I have internet challenges this side. Pardon me for that. May I, without any waste of time, call the meeting to order so that we can move on? Hello?
Hello, Honorable Chairperson. Maybe a moment.
I was
can
saying,
I
can I call the meeting to order so that we can quickly move on? Without any waste of time, let me ask the committee sec to take us through the credentials and check if we have the quorum so that we can start the meeting right away.
Thank you, Honorable Chair. In terms of the credentials, we still waiting for some more members. We only have Lesotho, Seychelles, Eswatini. Yeah, so far we have 3 members. We need to have 8 members to commence to start our meeting, Honorable Chair.
Please note Mozambique is also in the meeting, Janice.
Okay. Honorable Chair, we have four members. We still need to have 4 members to
Bom dia,
reach the quorum.
Angola também está presente.
Dennis, you take note. Angola is in the meeting
Yes,
as well.
yes. Yeah, I'm
Sure.
taking note. So far, we have 5 members. We are remaining with 3.
We have 6 in the meeting.
6. The 6th one, Mr. Shannon, is from, I can't press it properly.
So Angola,
We have Angola, we have Lesotho,
Eswatini,
Eswatini,
Mozambique,
Seychelles, and Mozambique,
and Tanzania.
and Tanzania.
Yes.
So we need 2 more members.
Namibia is also in the meeting, Dennis.
Yes. So we're remaining with one honorable member.
Dennis, we have a quorum. May we proceed?
Thank you. Honorable Chairperson and honorable members, we may proceed to commence the meeting. We have a quorum in place. Honorable Vice Chairperson.
Hello? Hello?
Hello,
Mr.
Honorable
Kondo.
Chair.
Mr. Kondo, we are experiencing network challenges this side, but I will try all I can, and hoping that things will get better as we move on. But in the event it doesn't allow me, we will have to find other means in which we can get the meeting going on.
We may proceed, Honorable Chair.
Yes, I was asking the SEC to do the credentials and confirm if we have the quorum.
Honorable Chairperson, we have confirmed we have 8 members in place. We may proceed with the meeting. We have reached the quorum.
Okay, thank you so much. Have we gone through the agenda? Are we fine with the agenda? Can we adopt it, or there's a feeling maybe to add or subtract some things? Any addition or subtraction? Hello? Hello? Hello, colleagues. Or maybe before we even look at at whether the agenda is okay or not okay, can I quickly go through these opening remarks so that maybe we can all get on board as to what is it exactly that we're going to go through? Are we fine? Hello?
Chair,
Are you there?
You may wish to consider adopting the agenda, because the remarks are part of the agenda that you must formally adopt first.
Yes, okay, thank you for that correction. Actually, I was checking if there are any submissions. Is the agenda fine? Are we fine with the agenda?
We may need to move to call for someone to move for adoption. I don't see any.
Can someone move for the adoption of the agenda? Is Tanzania moving? Anyone moving for the adoption? Say, Charles. Yes, I Charles.
Good morning. Good morning, Mr. Chair. Good morning, members. I move for the adoption of the agenda. Thank you.
Thank you, Sir Charles. Any seconder? Any seconder for the adoption of the agenda?
Bom dia, Senhor Presidente. Bom dia, caros delegados. Angola apoia.
Angola is seconding. Thank you. Thank you for seconding the agenda. So the agenda is accordingly adopted. Now we can move. Now that the agenda has been moved, it means we can now get into maybe the chairperson will have to make remarks so that we can right away run with the agenda.
Honorable Chairperson, you may wish to proceed making the opening remarks. It's in order.
Yes, let me get things. Distinguished participants who are also fellow members of the Standing Committee, Htsp, the Senior Management Team of SADC PF, resource persons here present, members of the press. It is great pleasure for me this morning to have an opportunity to stand and deliver opening remarks for the HSDP and SP meeting. And on the outset, let me recognize the presence of our distinguished partners from UNESCO. And I would like to also mention that UNESCO will take us through a presentation on East and Southern Africa commitment for comprehensive sexuality education, which is CSC in abbreviation. Honorable members, as you are aware, this meeting has been organized with the objective of orienting our committee on the Esa Commitment. The background on this is that in December 2013, ministers of education and health from 20 countries in Eastern and Southern Africa committed to scaling up comprehensive sexuality education and youth-friendly sexual reproductive health services for adolescents and young people in the region. Honorable members, in this commitment, governments under the leadership of EAC and SADC committed to improving sexual and reproductive health outcomes and strengthening HIV prevention through access to comprehensive sexuality education, as well as integrated sexual and reproductive health services for young people. By the end of 2020, the Esa Commitment had put the spotlight on the young people, promoted intersectoral collaboration, while rallying partners around 4 key results for adolescent and young people: reducing HIV infection, reducing early and unintended pregnancies, reducing gender-based violence, and eliminating child marriages. Honorable members, our committee is key in advancing accountability on the consistency, budgeting, and implementing of CSE programs in the context of SRHR as provided for in the international and regional human rights norms. And you may wish to note that one of the barriers to achieve CSE, which is comprehensive sexuality education, is unavailability of resources. And as parliamentarians, there is a need to see to it that national level has enough resources that are made available and channeled towards CSE implementation. Allow me, honorable members, to continue to further say that to this, as parliamentarian, we have a role to enact laws and policies with the aim of creating an enabling environment for the implementation of the CSC. We also need to enhance our oversight role with the aim of tracking progress in the levels of implementation of CSC by governments and other players. Honorable members, the expectation is that after this meeting, we will all have gained knowledge and clear understanding on issues pertaining to the ESA commitments and the CSE in general. So let me call upon each and every one of us to fully participate in the discussions and engage our resource persons on issues that will ensue during the deliberations. Honorable members, at this juncture, let me declare the meeting officially opened. I thank you. Thank you so much. I think having said that, we all understand why we are here, the expectation one, and what shall we have gained from this meeting. We need to understand the commitment that was made and see how best we can do something to get it on the ground in our respective countries. Can we, having said that, can we then check
colleagues from ICT, it appears the chairperson has been cut off for the meeting. Maybe you can assist. ICT.
I believe it is internet. He should be joining soon to get in touch.
Maybe as we are waiting for.
Hello, Dennis.
Hello.
The vice chairperson had indicated that because of connectivity issues, if he is affected, may we find a means for the meeting to proceed in the interim. And in that regard, you may wish to, in terms of the rules of procedure, in particular Rule 39.2, request for one of the members to be designated to serve as an acting chairperson. And then when the vice chairperson comes in, he may then proceed so that the meeting can proceed.
Thank you. I think we have to proceed in that way. Honorable members, any volunteer to take us, to lead us in this meeting in the absence of the vice chairperson?
Or better still, a nomination, if any of the members may wish to nominate another member.
Okay. Honorable members, you are being kindly requested to nominate amongst yourself a member to lead us. Honorable Kasim from Tanzania, would you wish to propose the nomination?
Because I'm the first time, so I will give a chance for my other to follow. Maybe if you have a senior, you can lead us.
The Angola, Seychelles, could you assist the Secretariat by volunteering to chair the meeting?
Bom dia, Angola não pode porque eu a meio da reunião terei que sair porque tenho hoje uma sessão solene na Assembleia Nacional. Peço desculpas.
Hello.
Maybe Seychelles?
Well, I've just been accepted to do the closing remarks, and I presume maybe I can volunteer for Lesotho. What about Lesotho? Lesotho can chair. I will second that. I'm proposing.
There's a proposal for Lesotho. Dennis, can we get Lesotho to confirm if they are ready?
Yes, we have Honorable Hosinkaze. I think he's in attendance.
Let's confer with the member whether he is ready to take the nomination and proceed to chair.
Okay. It appears we can't get through the honorable member. Maybe Sheshel should lead us, and then at some point we engage a different member to make the closing remarks for the sake of time.
I mean, she may still present the closing remarks, because remember the chairing, it's on an interim basis pending the chairperson rejoining.
Yes.
So you need to request the honorable member from Seychelles to reconsider and help us in the interim so that we are able to make progress.
Exactly. Honorable Bistoclet, are you in agreement?
Okay, I mean, I don't have any other choices, but I will take it because, well, so nobody's offering to do it voluntarily. May we proceed? I will chair during the interim that the chairperson comes back. I would not mind. Please.
Thank you, Honorable. We stopped at the point where the Honorable Vice Chairperson had just made his opening remarks.
Okay.
We have to proceed
To item number 3. We've already adopted the agenda.
Yes.
Now we go to item number 4, which is a consideration of minutes of the previous meeting of the HSDPSSB committee. Can we have the minutes, please?
ICT, would you please assist us in sharing the document?
Yes, I'm displaying it right now.
Thank you.
Okay. So the minutes can be viewed by all members, and that was the minutes dated 16th of April, which was done virtually. It's a Friday. It was a Friday. Can we go on the any corrections on the first present and those with apologies, probably names that have misspelled? If there's none, then we move to the matters arising. Okay, the agenda, where the credentials of delegates, welcoming remarks, adoption of agenda. Number 4, consideration of minutes of the last one. Matters arising from previous meeting, update on implementation of sexual reproductive health and HIV/AIDS governance project, briefing on SDPS annual work plan.
Excusez-moi. Je vais prendre la parole, j'ai quelques remarques à faire. Madagascar a quelques
Please go ahead,
corrections à faire.
Dr. Favarona.
Bonjour tout le monde, je m'excuse pour le retard parce qu'il y a des problèmes de connexion. Je ne sais pas si ça vient du vote, quoi. Mais j'aimerais faire une petite remarque. Il y a des changements sur la liste des participants. Au lieu de monsieur honorable Lucien Koutmara, qui est déjà parti au ciel, c'est le vice-président, Dr. Ferrou Louvanirine, qui est présent maintenant. Numéro 4. Donc, pour Madagascar, c'est Dr. Fiarou Vana Louvanirine, se distingue pas l'ancien défunt Lucien Rakoutmalal. Merci.
Thank you. Thank you, Honorable Dr. Fabio Rana. Please note, members, that the minutes we are going through were dated back on the 16th of April. So we are just going through the minutes. If there are any corrections, the minutes today, the participants will feature on the next minutes of meeting dated 15th of October. Thank you. Is that okay, Dr. Fabiana? Merci. Merci beaucoup. So we go on matters arising. Credentials of delegates and apologies. That is number one. Well, there were apologies recorded from national parliaments, South Africa, Namibia, Lesotho, Botswana, and Tanzania. 9 of 15 members parliament were present, according to the meeting, was deemed to be properly constituted. So with that was done. Number 2, adoption of agenda.
Por favor, eu queria
was
fazer uma correção.
Sorry, ma'am. Sorry, Honorable. Yes,
Bom dia,
Angola.
presidente da
Honorable Risa,
sessão.
go ahead.
Sim, eu queria fazer uma correção. Angola esteve presente na sessão passada e não aparece nem nas presenças nem nas ausências. Gostaria, por favor, que se fizesse a correção, porque Angola esteve presente. Muito obrigado.
Thank you, Angola. Thank you so much. So we'll have the correction being done, the Secretariat. So we move on to the number 3. Or number two, adoption of agenda was adopted without amendments on a motion by Seychelles and seconded by this was the 3-0. Welcome remarks by the chairperson, which was done by Honorable Beta. And can we move to 4.0? A consideration of minutes of the previous meeting held, that was on the 16th of October 2020. And the committee considered the minutes, and on the motion by Eswatini and recorded, seconded by Zambia. The minutes of previous meeting held was in October, as I tend to be corrected, and it was adopted. 5.0, matters arising from minutes of the previous meeting. 5.0, held virtually. There were no matters arising from the minutes of the previous meeting, as previous matters were already actioned by the Secretariat in collaboration with members of Parliament. If there's no correction, we move to 6.0, update of implementation of the sexual reproductive health and HIV/AIDS and governance project by the project accountant and the committee secretary. The committee secretary, Dr. Ngongwe, presented a brief overview of the SRHR project. He explained that the vision of the project was universal access to integrated SRHR and HIV/AIDS services and related rights, including bringing forward social changes, improved health and respect for human rights that were enjoyed by all the SADC region. And consecutively, the project was to work towards the achievement of this universal access to integrated SRHR and HIV/AIDS services and related rights through parliamentary action via the legislative, oversight, budgetary, and representative, and the roles of parliament. So in terms of implementation, he explained to the each national parliament that the activities to be implemented were circulated and by a MOU used by Secretariat at the beginning of the project. In addition, the Secretariat continuously engages with project researchers to ensure that activities are being promptly reported upon. Mitigation measures were also put in place to view of striving to attain the set targets amidst the challenges experienced due to COVID-19. Members of the Htsp committee recalled that all adaptive strategy was mapped on the project outcomes of the sexual reproductive project in view of the ensuring that remedial measures are taken to achieve the project objectives. The adaptive strategy was approved by the members the committee at the last meeting on the 16th of October 2020 and was thereafter transmitted to all SADC national parliaments through SRHR researchers. And additionally, SRHR researchers based in national parliaments met with UNESCO representative for deliberation on UNESCO SADC PF support, which is aimed at promoting awareness and acceptance of CSE in the SADC region, as well as securing the Esa Commitment beyond 2020. In February 2021, national parliaments managed to review their work plans and implemented most of their scheduled projects activities by the end of March 2021. Afterwards, national parliaments are to complete the country-level annual reports, which will be sent to monitoring and evaluation. The project accountant, Mr. Raj Kubal, explained to the committee that the SRHR project was being funded by SIDA to the tune of $3 million for a period of 3 years, and that due to this outbreak of COVID-19, the project encountered some challenges in the second year implementation, such as difficulties to hold some physical meetings, both at regional and national level, as a result of lockdowns and in all countries, confinement restrictions. Additionally, most SADC countries had imposed flight restriction, and this was an impediment to the organization regional meetings, which as a consequence resulted to a low utilization of funding. And move on. It was mentioned that there were some opportunities that arose during the course of the second year of the implementation, in the sense that the project had managed to conduct Zoom meetings and swiftly shift most of these meetings online. Additionally, the ITC framework under the project was strengthened by procuring laptops and cell phones for sexual and reproductive health researchers, now by providing data allowance to researchers and key project staff. This complemented an initiative of the forum to provide data allowance to recruited seconded staff to service the standing committees of the forum. The project accountant also explained that for the year 3, the project has a budget of 1.5 million USD, and the following activities would be implemented. 1, need to continue holding national working group meetings at national parliament level. Number 2, to continue holding capacity development of MPs and other stakeholders such as CSOs. Number 3, to facilitate the formulation of SADC model law on the public financial management in collaboration with the relevant standing committees, partners of the forum. Number 4, to hold public hearings and sensitization campaigns where appropriate. Number 5, to continue facilitating e-connection and the development of e-briefs. And number 6, to facilitate the recruitment of legal experts at national parliament level to assist on sexual reproductive health bill analysis and processing. The project accountant further mentioned that the expectation was that 2021 would be a better year for the project because there was high likelihood of conducting physical meetings both at national and regional level. The committee inquired from Secretariat as to why some countries like Madagascar were not part of the project, and it was explained that in the initial project's design of the project, all countries in the region were included, but for reasons beyond the control of the Secretariat, not all countries responded in relation to implementation at national level by the deadline set by the Dsp at committee at 31st December 2019. However, it was mentioned that countries which still want to participate in the project may do so by writing a formal request to the Secretariat, after which the Secretariat will take up the matter with other donors, especially Sweden. Number 7.0, briefing of Htsp annual workline by the committee secretary. The Secretary General, Mr. Ngwe, explained to the committee that the mandate of Human and Social Development Special Programs and its standing committee is derived from the Strategy Plan 2019-2023, the forum's constitution, rules of procedure, plenary assembly resolutions, and as well as previous committee resolutions, and that the main goal of the program is to deal with human and social development issues pertaining to health and combating illicit drug trafficking, HIV/AIDS, and education, among others. In addition, professional training, employment and labor, culture and sport, science and technology, and humanitarian issues also constitute bedrock themes for the HSDSP committee. Given the mandate of the committee to advance human and social development for the following initiative, were recommended: number 1, or A, under the objective enhancing the role of the forum in the fight against sexual reproductive health infringements, HIV/AIDS, and protection of key populations from a parliamentary perspective. The committee is mandated to hold a dialogue on key issues pertaining to the protection of vulnerable groups, namely the elderly, women and children population in the SADC region. In addition, a dialogue meeting would be held on emerging issues of pertaining to human trafficking in the light of COVID-19 pandemic. B, in accordance with the objective of enhancing the the cross-learning initiatives for the HSDPS, DSP, and other standing committees and the partners of the forum. The committee would conduct a joint session of HSDSP and Regional Women Parliamentary Committee on the SADC model law and on child marriages, and hold a training in conjunction with the partners on data capturing by reference to the data impact of the SHR and SRHR HIV/AIDS Covenant Project. And C, additionally, the committee will hold a biannual meetings to discuss the progress in the implementation of the sexual reproductive health and HIV/AIDS Covenant projects, and also conduct follow-up meetings to check up on the implementation of the regional commitments and resolutions. Example, the CSC, the implementation of regional commitments and resolutions, the domestications of SADC model law on child marriages and public financial management. So the committee approved by the annual HSDSP work plan as presented and urged the committee secretariat to properly design the activities with timeframes for proper follow-up in the implementation processes. Number 8, that was recommendations. It was recommended that A, the committee implements its work plan relating to SRHR by keeping the timeframes that can be monitored and to continue to implement all the project outcomes under the SRHR project. Number B, recommendation, the committee continues to work in collaboration with other standing committees and organs of the forum, such as the RWPC and the Regional Parliamentary Model Laws Oversight Committee, to find ways and means to fulfill the objectives under the project in attending universal SRHR services for all in the SADC region. C, that further engagement continues to be made by committee members in championing SRHR issues through model laws and other standing setting instruments developed by the forum. In this regard, the forum must ensure that the region continues to domesticate the SADC model law on child marriage and the minimum standards for key population in the context of HIV, as these are fundamental to the progressive assimilation of norms contained therein. The committee recommended that the recommendations made be embodied in its report to be presented to the plenary assembly. In conclusion, that is number 9, concluding remarks. This was done by myself on behalf of the chairperson. And we also iterated the committee's appreciation for the Mr. Kabul, that's Sexual Reproductive Health Project Accountant, for the elaborate explanation of the committee. And the project will allow the committee members to make evidence-based interventions. And I presumed this was done during by the interventions during the deliberations with the national parliaments at the forum. AOB. Okay, we move to AOB. Any other business? Okay, number 10, there being no further business to transact, the meeting adjourned hours. Thank you. And the chairperson and the committee secretary. Any amendments or from the minutes that the committee would like to put forward? If not, then we can move to, we can adopt minutes. Can we adopt the minutes? Can we have somebody to to say that we adopt the minutes? Any volunteer? And then somebody to second? We need somebody to adopt the committee members. Can we adopt the minutes? Iswatini? Can we adopt the minutes?
I move that we adopted the minutes.
Iswatini has moved to adopt. Can we have somebody to second the adoption? of the minutes?
Angola, segunda proposta de
Madagascar.
aprovação da ata.
Madagascar.
Yes, Angola and Madagascar supporting us. It's the second month of the motion to adopt the minutes. So noted, Secretariat, the minutes have been adopted by members present. Can we move to item number 5? So we approved, we've done that already. Item number 6, Secretariat, can we move to SADC, the members present? Presentation by UNESCO on the proposed draft of Esa ministerial commitment. And the presenter will be Remuni Shawa. I don't know whether I've pronounced it properly. Mr. Shawa, can we have the presentation, please?
Thank you very much, Chair. Good morning, honorable members. And thank you so much for having UNESCO on this in this meeting. I will share my screen and I've switched on my video, but if the bandwidth is slow, then I will turn it off. I hope that you could see the screen.
Yes, it's quite visible.
A reminder on where we're coming from for colleagues that might have not been part of the process of the Esa Commitment. The Esa Commitment was affirmed in 2013 by 20 countries, represented by the Ministers of Education and Ministers of Health. And then in 2016, they recommitted and developed a roadmap that was going to see the commitment to go towards 2020. And then in 2020, an evaluation of the commitment was commissioned. These are the countries that endorsed the commitment back in 2013. That's about 7-8 years ago now. And just to remind us that the commitment was the Esa Commitment or ESA Commitment on Comprehensive Sexuality Education and Access to Youth-Friendly Services. It had targets set out for 2015 and 2020. The 2020 targets looked at around reducing new HIV infections among young people, as well as increasing knowledge among this age group, prevention of unintended pregnancies, as well as eliminating gender-based violence and increasing numbers of schools that were providing comprehensive sexuality education. So in 2020, when the evaluation was commissioned, the major aim of the evaluation was to assess progress made in achieving the target set in 2015 and for 2020. It was also to look at the processes, for instance, the efficiency. Is the Esa Commitment efficient enough, and what is the multi-sectoral mechanism for coordination in place? The evaluation used the DAC criteria, so it looked at effectiveness, relevance, and coherence. It also looked at efficiency and sustainability, as well as some emerging issues. So I just wanted to briefly share what we learned from the evaluation before I go into the proposed Esa Commitment. And just to remind the House that the Esa Commitment is now being proposed to be renewed from 2021 until 2030 in order to align with the SDGs, but also the SADC SRHR strategy. In terms of relevance and coherence, the ESA commitment from the country level showed that the commitment had increased political will and engagement on adolescent and youth SRHR, and that countries with legal and policy frameworks had developed legal and policy frameworks in place in order to advance the commitment. We also learned that it facilitated the creation of advocacy windows for CSOs. It gave them a platform to be able to advocate for policy change, for new programs and projects to be implemented. And that despite political will, there were challenges that continued to remain around harmonization of laws in order to align with national commitments, especially related to the issue of age of consent to sex, to marriage, to accessing SRH services such as family planning and other commodities. Esa commitment targets do not detail progress towards effective and supportive implementation of law for adolescents and youth. So it wasn't really looking at the targets on implementation, but whether or not those laws and policies had been ignited and they were in place. At the regional level, the evaluation told us that the Esa commitment raised awareness with the regional economic communities, so in particular, the EAC and the SADC, of fundamental importance of improving adolescent and youth sexual reproductive health in our region. In terms of the relevance, it had relevance to the needs of adolescents and young people. It contributed to the acceleration of legal and policy developments and the strengthening of SRHR. Now, when we look at whether or not the Esa commitment was effective, these are the criteria that the evaluation tried to measure. So was there the existence and implementation of good quality CSE curriculum framework? Did countries establish and implement pre and in-service CSE and SRH training for teachers and health and social workers? Adolescents and young people's equitable access, acceptable, appropriate and effective access to youth-friendly services, was that ensured? Were new infections among young people eliminated? Could we demonstrate an increase in comprehensive HIV knowledge prevention among adolescents and young people? Did we manage to reduce early and unintended pregnancy, to eliminate gender-based violence, to eliminate child marriage, to provide CSE in schools, and to develop an environment that was enabling for laws and policies? I also want to bring the attention, Madam Chair, of the members of the House that we have a dashboard that we are putting in place. It's now work in progress, but it's available, and I'll speak to it in the next slide. But this is a dashboard that looks at the countries in the Esa commitment and tries to look at how much progress they have made since 2013 to 2020 in terms of implementation of a number of indicators. These indicators look at CSE, they look at HIV, they look at early and unintended pregnancy, child marriage, they look at school enrollment, etc. So when you get to the dashboard, and I'll share the link in the chat when I finish the presentation, you can access the dashboard on the link that I'll share, and then you are able to zoom and see different countries listed in the Esa commitment. You're also able to pick a particular country that you're interested in, and then you're also able to pick particular indicators that you're interested in. So for instance, you can say, I want to look at Botswana, and then I want to look at new HIV infections. Then it will show you how Botswana has done from 2013 to where they are today. And then you're also able to download the graphics and the data that you're interested in case you want to use that for your presentation or for any communication purposes. So in the next slides, I'll show now what you will find on the dashboard as an example. We picked out specific indicators based on the targets of the Esa commitment. On this slide, we have eliminate all new HIV infections among adolescents and young people, where we are learning that new HIV infections among this age group, 15 to 24 years, declined by 30% between 2013 and 2019. But although we have made that progress, we know that adolescent girls and young women account for over 25% of new infections among this age group in the region. And that adolescent girls and young women are also more likely to acquire new HIV infections than other male peers. And on a weekly basis, there are at least 4,000 new HIV infections among adolescent girls and young women, which is more than double than that of males, which is 1,700 new infections for boys. So 4,000 new infections a week for girls and 1,700 infections a week for boys. Another target was around increasing to 95% the number of adolescents and young people who could demonstrate comprehensive HIV knowledge. Unfortunately, although there was a slight change, it wasn't impressive enough. The percentage of young people aged 15 to 24 who have comprehensive HIV knowledge prevention only increased by 4%, from 36% to 40%. This is a regional average. So some countries had, higher increase than others, and you will be able to see when you zoom in on a specific country. We know that this is relatively low, and it puts us back a little bit from the 95% that we wanted to achieve. So there's a lot of work that still needs to be done to increase comprehensive knowledge. In terms of reducing early and unintended pregnancy, the target on EUP was looking at, and this is what countries committed, that by 2020, countries would have been able to reduce by 75% the rate of early and unintended pregnancy. However, we know from the evaluation that progress remains significantly low across countries, with declines in rates of early and unintended pregnancy ranging between under 1% to about 3.9%. Thus, we failed to meet the mark absolutely. In terms of child marriage, the progress in ending child marriage was not universal across the region. We saw some declines in 9 of the 11 countries that provided the data, but still, there's still a lot of work that needs to be done to reduce and eliminate child marriage. Around a good quality CSE curriculum framework being in place, by 2018, 10 of the 15 countries that provided the data had surpassed the 75% target on schools providing life skills-based HIV and sexuality education coverage, and it ranged from 75% to 100% for some countries. And then in terms of the good quality CSE, again, 18 of the 21 reporting countries had a CSE strategy or framework for out-of-school youth. So looking at, do they have a strategy in place to provide CSE even out of school to young people who are not in schools? On gender-based violence, government made significant strides in creating an enabling environment to address gender-based violence. One of the issues that was highlighted was ending school-related gender-based violence, where by 2018, 18 countries had education sector policies that address school-related gender-based violence. This is the gender-based violence that happens in or around schools. And then in terms of pre and in-service CSC and SRH training for teachers and health workers, by 2018, all 21 countries reported that they were providing pre-service and or in-service training programs on the delivery of adolescent and youth-friendly health services to teachers and to health workers. In terms of the efficiency of the Esa commitment, the report reported that there were some gaps in the lack of strength and responsiveness of M&E systems in some countries. So you see, when you take a closer look, that there was not available data in some of the countries, just indicating the challenge of data and M&E. In terms of resourcing, the report reported that there was an increase in resourcing for priorities in the Esa commitment. However, scale of increase was difficult to quantify as allocations were not earmarked or clearly tracked in country budgets. So the question, for instance, we would ask is, does country B have a budget to meet some of the targets in the ESA commitment. And other countries would report that yes, because that falls under the health budget that goes to sexual and reproductive health. And others would say, yes, we have specific budget that is earmarked for the ESA commitment. Funding sources, it was reported that there was donor dependency in the countries where if we took out the donor resources, then some of this work would stop. So again, a proposal or a recommendation from the report is that there's need for more domestic resources to be able to increase implementation. In terms of regional coordination, at the regional level, it was reported that there was effective coordination from different sectors at the SADC level, as well as at the EAC level to meet the targets. But most coordination successes at regional level attributed to the leadership of influential individuals who facilitated key political processes and drove engagement of some stakeholder clusters like CSOs, and that both ESC and SADC reported having inadequate human resources and financial support to fulfill their coordination roles, and there were significant gaps in the ESC in their ability to effectively coordinate. About sustainability, levels of national ownership of the ESA commitment by governments are mixed across the region. You see some of the countries have taken up the ownership, and so we know that it can be sustainable, whilst others still needs to do more. Significant policy and legal changes achieved across most areas, but dissemination and implementation or enforcement remained limited. And across the region, there was a tendency that out-of-school youth CSC remained implemented at a very small scale, maybe even left out to NGOs to do the work as opposed to government. There was insufficient data collection related to youth-friendly services in some countries that prevented the monitoring and evaluation. And then COVID-19 came and it hit us hard, highlighting the sustainability gaps of youth programming as domestic funding was redirected from this work to COVID-19. A range of strategies were put in place to improve multi-sectoral and multi-stakeholder collaboration, but that improvement needs to be strengthened. The ESA commitment provided an exchange platform, like a peer mechanism where country A and country B can share some lessons. All right, let me quickly now go to what is being proposed. And I would like for members of the House through the chair to reflect on these questions as I speak to the next slides on the proposed ESA commitment. What emerging issues or themes are missing from the new text that is being proposed? What key steps need to be taken to ensure that the commitment is endorsed by ministers in December 2021? And then the final question at the end would be, would you recommend or does the House recommend that the text of the commitment be endorsed by the relevant ministers? And if they do not recommend, if you do not recommend, why wouldn't you recommend? So these are some of the themes that you find in the old ESA commitment that expired in 2013, really just showing where we were in 2013. There was a need for CSC, age of consent, harmonization of laws around age of consent, access to SRH services, issues around addressing pregnancy, etc. But now, 8 years later, there's some lessons that we have learned. The available data and reports from the ESA commitment highlights the process of the affirmation and endorsement, as well as implementation until mostly 2018, because the evaluation started in 2020, and the data that was available, most of it was around 2018. And that while there were challenges that could be reported, a lot of significant progress had been made. I also want to make a note that when we're looking at these indicators and the targets, we cannot attribute all this to the Esa Commitment, because the Esa Commitment is more like a framework of operation. It's a platform, it's an initiative, it's not a specific project. However, we know that it created an enabling environment for these multiple SRHR programs to come up. Some of you have heard the Our Rights, Our Lives, Our Future program. You probably have heard the Together for SRHR program. You've heard of the Safeguard Young People SYP program. All these emerged after the Esa Commitment, and the Esa Commitment provided that platform. So we have been engaging different stakeholders, looking at the question of what needs to be the next Esa Commitment if we are to renew it until 2030. And some of the stakeholders we've engaged, and we will continue to engage, through the national consultations. The civil society have been mobilizing. We have engaged the SADC ministers of education already. We'll be engaging the ministers of health in November. We've had the SADC Youth Forum, we have had the SADC SRHR managers, we've had the National AIDS Council directors, and now here we are with the SADC PF parliamentarians. We have also the EAC SRHR managers who we are engaging from a meeting that we started on Wednesday and is ending today. Some of the issues that are coming from these consultations that happened at the country and the regional level, that the new commitment needs to look at mental health. That's one thing that was left out in the old commitment, issues around drug and alcohol abuse, disasters and pandemics like COVID-19, cholera, as we have learned, Ebola, etc. Enforcement of environment and climate change, that we need to look at menstrual health, we need to look at human rights and building back better after COVID-19. There are also some strategies that are being proposed from the consultations that we need to engage parents more. So parent-child communication was highlighted, that the universal health coverage needs to include the components of adolescent sexual and reproductive health, that domestic resource mobilization is important, and that we need to align the new commitment to existing initiatives. There's also need for gender transformation and gender transformative programming. And then these consultations also highlighted some populations that we need to prioritize. And at the center of that are young people, but also young people with disabilities, young people living with HIV, adolescent girls and young women, and also parents, health workers, teachers, parliamentarians, religious leaders, and traditional leaders. And also some of the cross-cutting issues are around coordination, that the Esa Commitment should create a platform for better coordination of civil society, of government, of different stakeholders, and that it should go beyond health and education. And we'll talk to that in a bit. So as of end of September, this is how the draft commitment looks like. And I'd like for you to just reflect and see if you see something missing, please just take note of it, so that at the end you can raise some of the emerging issues that could be missing from the proposal. You will see that the draft commitment has three elements: the preamble, it has the unfinished business, and it has the actual commitment. I have sent this draft to the secretary of the committee, and I hope that he can share with honorable members. But I would like for you to focus more on the commitment itself, because this is what we will hold the countries accountable to. In the preamble, we are now pushing for a commitment that goes beyond health and education, that it should be endorsed by ministers of gender, youth, of health, and of education together. So it should be 4 key line ministries. And there's also an emphasis on education, that this time we really need to push for education for all, but in particular, girls' education. It makes note also to the previous commitment, and there's a slight change in the language from talking about comprehensive sexuality education to looking at education for health and well-being. This is quite important in line with what we've been getting from countries where they're saying, look, we have issues with the terminology of CSC. Maybe we need a terminology that's going to be universally acceptable by all member states. So the new terminology that we're using in the new commitment is education for health and well-being. In addition, the commitment now is changing from an ESA commitment to CSC and SRH services to an ESA commitment to education, health, and well-being of adolescents and young people. It also recognizes the role that COVID-19 has played and the vulnerabilities, increased vulnerabilities among young people. It recognizes that our region is experiencing a youth bounce of more adolescents and young people, and almost 169 million, or 33% of the total population is aged 10 to 24. It aligns with other strategies you will see in there: Continental Education Strategy for Africa, CESA, the SDGs, the AU Agenda 2063, the ICPD Program of Action, the SADC SRHR Strategy, and so on. In terms of the unfinished business, the ESA commitment that's being proposed highlights that there are inequalities in the education sector and in access to education due to COVID-19, but also other issues. We know that as a result of COVID-19, there were and the closures that came with that, 1.6 billion learners were out of school in more than 190 countries. New HIV infections. We know that 5 in 6 new cases of HIV are among adolescents 15 to 19 and who are young women and girls. There's insufficient progress to reduce early and unintended pregnancy. I showed that in the slide when we're showing results from the evaluation. So this is another thing that we need to pay attention to. On mental health, we know that suicide is the 3rd leading cause of death in older adolescents 15 to 19, and that more than 90% of adolescent suicides occur in developing countries. We also are stating in the unfinished business that of the estimated 5.6 million abortions that occur each year among young people 15 to 19 years, 3.9 million of those are unsafe. So more than half of them. Climate crisis. Due to COVID-19 and what we have seen in terms of war and civil strife, that there are humanitarian challenges that are worsening. Therefore, the ESA commitment should factor that in. Also, the issue of exposure to illicit sexual content online. How do we create safe digital spaces for adolescents and young people? So in the proposed commitment, and I'm now getting to the end of my slides, we have universal access to quality primary, secondary, and informal education. We have building back better after COVID-19 and other pandemics, so resilience. We are calling for economic opportunities for young people through job creation, entrepreneurship, and digital jobs. Countries are calling for high quality, gender responsive, and age-appropriate education for health and well-being. Countries and communities are calling for youth-friendly services that not only are on HIV, but they should be integrated, and they should integrate HIV, SRH, including sexually transmitted infections. They should include services on mental health and psychosocial services, as well as GBV services. And that we should address the structural barriers and social drivers of HIV and gender-based violence. For instance, on early and unintended pregnancy, we know that poverty is one of the major drivers of teenage pregnancies. The commitment also is proposing that we include adolescent sexual and reproductive health services within the universal health coverage package for the countries, that there should be domestication of continental and regional commitments. It also speaks to providing young people with platforms and resources to meaningfully influence legislation and policy. It speaks to strengthening multi-sectoral evidence-based programming on child marriage, teenage pregnancy, HIV, and gender-based violence. It also speaks to strengthening social protection systems to strengthening community engagement and parental involvement, or involvement of traditional and religious leaders, and also to strengthening the collection, analysis, and use of disaggregated data. We have put together some resources from the regional level, and this is the technical coordinating group of different stakeholders, which can help country actors in case you want to do advocacy to fellow honorable members of parliament or to your communities and constituencies. The resources include an asset folder. Let me take note here, if the asset folder hasn't been shared already, that it should be shared as part of the meeting documentation. The asset folder includes all the documents related to the Esa commitment from when we started now. It also has presentations, including this very presentation I've made, but other presentations from other agencies and partners looking at adolescents, the state of SRHR among adolescents and young people, the state of HIV among children, etc. So please, I hope that you find that useful. We have a Young People Today website that was launched at the beginning of the commitment and is now being revamped to make sure that it appeals to not just policymakers, but also to young people, so that when somebody wants to quickly find something about the Esa commitment, they can go to the website and then they'll see, okay, what's happening in these countries or at the regional level. So that's the work that we are doing. We have prepared a media package that if you work with media houses to enhance better reporting and coverage on sexual and reproductive health, this media package helps the journalists and other media houses. We have a dashboard that I spoke to now, and we've prepared 2 policy briefs, one on health and one on education. They basically just unpack what is in the evaluation and make a case, for the Esa commitment. And finally, again, reminding us, and I think this builds into the next agenda item, Chair, but these are the discussion questions. What emerging themes and issues are missing from the new text of the Esa commitment? What key steps need to be taken to ensure that the commitment is endorsed by ministers? And this time we're looking at 4 ministers per country: health, education, gender, and youth. By December 2021. So the aim is to have the endorsement on the sideline of the ICASA 2021. And then do you recommend the text for the commitment to be endorsed by ministers, relevant ministers? That was a mouthful, but again, thank you, Chair. I'm here now to take any questions, any feedback. Over to you, Chair.
Thank you, Mr. Remy, for the, I should say, a very comprehensive, explicit, qualitative, but at the same time quantitative report from UNESCO, the draft report, evaluation and monitoring from the 21 countries of the EXA region on on comprehensive sexual education of the adolescents especially. And as the presenter has stated, Dr. Remy, that honorable members, we should focus our emphasis on the commitments, especially those that to be endorsed by our ministers for health, education, gender, and youth. Thank you again, Mr. Remy. And SADC region, SADC Secretariat is the chair in, please. SADC.
Honorable, the Honorable Chair is in.
Okay.
And he may lead us in the discussions and make the concluding remarks. Honorable Chairperson.
Thank you.
Thank you, Seychelles, for rescuing Eswatini. We are experiencing network challenges, and you just came in at the right time to rescue us. Thank you once again, Dr. Remy Shawa for the presentation on behalf of UNESCO. I think without any waste of time,
may I say Eswatini. Siyabonga kakhulu.
Yeah, siyabonga kakhulu Seychelles. Kusibambisa. Yes, I was actually saying thank you so much, Seychelles, for coming in, and thank you, Dr. Remishawa, representative of UNESCO, for such an informative presentation, which was actually telling us how far we are moving as those 21 countries that made a commitment in as far as those different issues are concerned, which range from child marriage is, I can't repeat that because it has already been presented, but I would like to invite honorable colleagues, if maybe you have some impression to make with regard to the presentation, any questions, clarity seeking points, or addition or subtraction. Whoa. Anything from the honorable members? Yes, Seychelles.
Thank you.
You can go ahead.
Yeah, thank you so much. I would like to ask Dr. Rumi. I've seen on the dashboard what he presented. There was so much spaces that it was stipulating as missing data. It is missing data. What has been the constraints or the problems encountered or the issues encountered for countries not to submit or the missing data from various from the countries? And the other thing is that the presentation, I have not seen much on, it's mostly about adolescents. And in regards to cancer, I haven't seen much in regards to vaccination of the young girls or the young boys to prevent cancer of the cervix, which it is a prominent issue as a non-communicable diseases in most African countries or into the Eastern and Southern African countries. Well, in fact, it has not been featured much. Those are the two issues, and then probably I will come around for others. Thank you very much.
Thank you, Seychelles, for your questions. Can we take more questions before the doctor responds? Any more questions? Any more hands? Let me then ask the doctor to respond to the questions raised by Seychelles while other members are still working on their questions and concerns. You may respond, Doctor.
Thank you very much. And I'm glad that you picked that one up on the data, because that was the major challenge of the evaluation. And this is why, because when the Esa Commitment was endorsed and then a regional accountability framework was put in place with indicators and targets and to be able to monitor, the thinking from the countries that it shouldn't be something new. The framework should be linked to existing data sources. So one of the major data sources was the demographic health survey. Another one was the multiple indicator cluster survey, the MIX, and then the education management information system, the AMIS. Now that's the major challenge, because not every country is able to run the DHS data. Some of the countries, their latest DHS is as old as 2014. So when we were doing the evaluation, we had a cutoff point that if you're looking at the baseline data, it has to be data only by 2013 or before. And then if you're looking at end line, it has to be 2018 or newer. So 2018, 2019, or 2020. That presented a major challenge because some of the countries, in fact, most of them hadn't done any DHS between that time frame, and even the available data that was there, was falling outside the coverage of the evaluation. So in the next commitment, and we had a regional consultation that just ended on Tuesday, what countries were proposing is that, maybe this time the results framework should be more ambitious and not just say, let us use existing data sources, but think about, what, first of all, if we have to put an adolescent and a young person here, and then say, what do they need? And then design the commitment around the needs of that adolescent, and then be able to measure whether or not we're making progress for those needs. So it might include proposing new data sources, whether it's proposing a population survey to be conducted maybe 2 steps of the way between now and 2030, but that we shouldn't just rely on existing data sources. But thank you so much for really catching on that. And then cancer, yes, absolutely, cancer is missing, and I've taken a note here as one of the emerging issues that the new commitment needs to consider. Thank you. Over to you, Chair.
Thank you, Doc, for your response, and I hope Honorable Seychelles and Honorable Rosie has got what she was looking for. Any more concerns with regard to the presentation, UNESCO? Any hand? Seychelles, you want to make a follow-up? You can go ahead.
Yes, please. Thank you very much. In fact, the response was what I was thinking of. But then there was one slight thing I would like to ask again. The presentation or the evaluation, I have not seen any issues or findings in regards to the rights of the adolescents, to the rights, especially when it comes to what are other countries are facing in regards to barriers for adolescents to access services, which I think it is a major concern for especially for emancipated minors in our region. Thank you very much.
Thank you, Seychelles. Maybe the doc can come in again to allay Seychelles' anxiety on this matter.
Yes, no, thank you, Chair, and thank you, Honorable, for the question. Yes, so when you, and I hope that you have received the full evaluation report. So we have an evaluation report, and then we have a summary, an executive summary, which can stand alone, for easier perusal. But yes, the issue of access to services in terms of the rights of adolescents did come up from the evaluation, mainly from the point of view of laws and policies around age of consent. So that, was a major theme where, some countries have not harmonized the age of consent to accessing to services, as well as to sexual activity. So for instance, an adolescent would want to access the services, but because they don't fall into the legal age, then they would face those barriers. So the recommendation that the report was making is that we need to harmonize, those policies that look at age of consent to accessing services.
Thank you, Doc. I think you've done even more than what she was looking for. Any more questions? Concerns? In the absence of questions and concerns, I want to believe that the presentation was even more clearer. We have picked almost everything. And I think according to our program, the presentation actually brings us to the end of our meeting today. Is that right?
Just one more question from us, Honorable Chair. Is the question to the members is, would you recommend that the Esa commitment be endorsed by relevant ministers?
So sorry, You mean us as a committee?
Yes, you as a committee.
Okay. Good people, there is that recommendation that we may need the ministers to endorse the Esa commitment. Can we move that we endorse I mean we made that recommendation. Do we take that recommendation for them to endorse this commitment? Are we together? Maybe, can you come up again with the concern of the recommendation?
Yes. No. So the question is if there could be a member who can propose that the Esa commitment be endorsed by relevant ministers in December, and then if the House can second, and that would be really appreciated. Okay, thank you. Can someone move that we take this recommendation so that those relevant ministers can endorse the commitment when they meet in December? Any mover? Any mover? I can't see any hand. Do you understand the recommendation? Yes, Charles.
I will second. I will move that the commitments shall be endorsed by the ministers the 4 ministers, in fact, from various countries, that the commitment be endorsed by them, namely health, education, gender, and youth from all the SADC region. Thank you very much.
Thank you, Sir Charles. And seconder, it has been moved that this commitment be endorsed by the relevant ministers in December. Any seconder? Any seconder, honorable members? Madagascar, go ahead.
Je crois que je suis vraiment d'accord avec les CICEL pour leur proposition, qu'il vaut mieux que le ministre qui va entériner lors de réunion au mois de décembre. Il est plutôt raisonnable d'attendre cette réunion afin que le ministre puisse entériner cette recommandation.
Thank you, Madagascar. Thank you, Madagascar, for endorsing that. I mean, for seconding that the relevant ministries should endorse the commitment. I think with that we have come to the end of the meeting. Is that right? And maybe before, is that right, Mr. Konde? This brings us to the end of the meeting.
Yes, Honorable Chair. The fact that the presentation has been made and the members proceeded to make some deliberation of the presentation.
Yes.
And you have rightly proceeded to adopt or to recommend that the ministers should proceed with the Esa commitment. We have come towards the end where you have to make the closing remarks, Honorable Chair.
Mr. Kondo, I thought you relieved me on that one. Someone else was supposed to make the remarks.
Honorable
and I was
Chair,
happy with it.
Yes, you have Initially, Honorable Rose was supposed to make the closing remarks, but the fact that she took over your chair, maybe you may proceed to nominate another member to do the closing, or you may proceed to make the closing remarks yourself. I don't know.
Honorable Chair,
Yeah,
I don't mind to conclude.
Please do, Moso, because you also
Thank you.
drove this vehicle. Please do make remarks. It's okay.
Thank you. We are both drivers in one vehicle.
Yeah.
Thank you, Mr. Chair. So distinguished participants who are also fellow members of the Standing Committee of the Human and Social Development and Special Programs, the senior management team of SADC-PF, resource persons and partners here present, members of the press. Once again, it is a great honor for me to stand and make a closing statement for the Htsp meeting. Honorable members, I am delighted to note that as a committee, we have been able to meet virtually and hold our meeting as planned. And let me take this opportunity to thank the Secretariat for their effort to facilitate the holding of this meeting. Honorable members, during this meeting, the committee has discussed a number of crucial issues in relation to the Eastern and Southern African commitments and the comprehensive sexual education issues in general. As noted from the discussions during the plenary, we have all testified that we still have a long way to go as a region in promoting and in advancing the CSE agenda. And this signifies the need for us as parliamentarians to take an active role into this implementation of the Esa Commitment. Honorable members, let me also express my sincere gratitude to our distinguished partners from UNESCO, Dr. Remy, for sparing their time, especially his time out, his very busy schedule, to come and make a presentation to us. The presentation was quite informative, and consequently, as a committee, we have learned a lot, and we now have a clear picture on the successes that have been made towards achieving positive CSC's outcomes, as well as the bottlenecks that are hindering the smooth implementation of CSC programs, and especially, I would say, the missing data from various countries. Honorable members, a number of issues have been discussed during the deliberations, and I hope the Secretariat was attentive enough and managed to capture the issues in detail, which will form part of the committee report that will be presented to the upcoming SADC-PF plenary assembly. Honorable members, without wasting much of our time or your time, I know you are very busy people, let me declare the meeting closed and wish you safe stay. Thank you to all, the SADC-PF Secretariat and honorable members. Thank you very much. And thank you, Mr. Chair. Mr. Chair, we cannot hear you.
Goodbye, everybody. Right.
Thank you, Honorable Chair and Honorable members. Goodbye.